Let's discuss about varicoceles. How common are varicoceles? So if we take as total adult population, about 15% have varicoceles, but in infertile males they can be as high as 40%. So in normally the veins, they return the blood to the heart through 1 way valves, and that allows the blood to travel toward the heart. But if in case of varicoceles, as we can see here, the veins are defected. They have weakened valves, and that leads to the blood flowing backward and pooling in the veins, which leads to the varicoceles. Which side is affected more? Usually 85% are the left side varicoceles, but in 15% of the cases they can be bilateral. Having a right unilateral varicocele is very less common, and mostly it happens because there might be some pathology which might be running up in the retroperitoneal space. Why are varicoceles more common on left? The reason is asymmetric gonadal vein anatomy. We can see here in this image, this is the this is the renal vein, this is the left spermatic vein, this is the right spermatic vein, and this is the vena cava. So what happens is the left one, the left spermatic vein, it enters perpendicular to the renal vein. As we can see here, it is entering the perpendicular to the renal vein. While the right spermatic vein, it is entering obliquely to the inferior vena cava. This appears to have some protective effect on the right side. So that's why on the left side, the varicoceles are more common. How should we examine the patient? The patient with varicoceles should always be examined in the standing position. When the temperature is apt and patient is relaxed. How do we grade the varicoceles? There are 3 grades of varicocele. The first grade is if the varicoceles are only palpable with patient performing the Valsalva maneuver. Grade 2 varicocele, when the varicoceles are palpable in the standing position without Valsalva maneuver, while the grade 3 varicoceles are simply visible through the scrotal skin. Is there any role of ancillary methods? By ancillary method we means the ultrasound, the venography. So is there any role of doing those if the clinical method is not showing the varicocele? Usually we call it as subclinical varicoceles when the varicoceles are only identifiable with the ancillary techniques but not palpable by the physical examination. Ancillary techniques such as ultrasonography or venography may be utilized when the physical examination is suboptimal, as in the case of obese patients, patients with small scrotums, or who are unable to tolerate a physical examination due to vasovagal response. How do varicoceles appear on ultrasound? This is how they appear. We can see here they are like a bag of worms. So these are the varicoceles.